Hi, thank you for joining us. I'm Rhonda Kelly, Executive Director of the All Clear Foundation and founder of Responder Strong, here with Dr. Jaime Brower of the National Emergency Responder and Public Safety Center and Brower Psychological. We are pleased to be creating this series of self-coaching modules for inclusion in our U Responder Strong wellness tool and other venues to allow responders, healthcare workers, and our family members the opportunity to really address some of the biggest challenges we're seeing in our lives. Topics such as stress management, who doesn't need that? Anxiety, depression, substance misuse or overuse, the topics that are plaguing our professions and our families, especially in light of the past couple years of innovative challenges in our lives. To give you a little background, I started in EMS back in 1996, subsequently served as a firefighter paramedic for 17 years, while working on the side as an ER and a psych ER nurse before founding Responder Strong. Currently, I work with Global Medical Response, developing their health, wellness, and resilience program for their personnel across the U.S., and I'm also guiding the All Clear Foundation. Our mission as a 501c3 is to improve the overall well-being of emergency responders, frontline healthcare workers, and our families. We recognize that the families often wear an invisible uniform and sometimes suffer for our service in ways that they're not aware of. So our mission is to work together with strategic partners, like Dr. Jaime Brower, to create an easily accessible, navigable system of resources, including this self-coaching series for responders and healthcare workers and their families to better their own lives. Jaime, I'll let you give a little bit of your background.
Okay, so I am Jaime Brower, Dr. Brower. I am a licensed clinical psychologist in several states, and I'm an ABAPT board certified psychologist. So police and public safety certified through the American Board of Professional Psychology. And I'm their academy president and responsible for ongoing training, education, et cetera, of those clinicians who work with emergency responders. I'm also the founder and CEO of the National Emergency Responder and Public Safety Center, also a great online resource for training and education, not only for responders and frontline workers, but also for their families and for the clinicians who work with them. We've got a one-of-a-kind clinician certification that we have on our site, and kind of a nice house of resources for folks, very similar to some of the work that All Clear has done as well. So very much so on the same page. I'm also the owner of Brower Psychological out of Denver, Colorado, and we do a ton of clinical work for several hundred agencies, not only in Colorado, Wyoming, and across the country, but we do a lot of work. So a lot of training, mental health support, really covering a lot of the topics that we're going to cover in these modules.
And the intention of the self-coaching series is, multi-pronged. One, we recognize that many responders would prefer, and healthcare workers, to solve problems on their own before reaching out for professional assistance. I can't tell you how many times as a peer supporter I've heard other firefighters tell me, stop counseling me and just give me the tools to fix this. This is what this is. This is a guided coaching module that allows you to progress at your own rate through these series. And we'll cover a variety of topics, including stress management, anxiety, depression, substance misuse or overuse, things that are really challenging the healthcare community, the responder community, and our families.
Sleep and recovery.
Sleep and recovery is another big one. So over this series, we are looking to provide participants with an opportunity to guide themselves to heal burnout, compassion fatigue, to help improve their overall quality of life. That being said, we know there are several of us out there who are at the point where we're thinking, I don't know if I need help or not. I'm not happy living the way that I'm living. This is also what this series is guided for. Go through this series. If you get to the end, congratulations. That's wonderful. You've completed it. You should be feeling better. If you're not, that's absolutely fine. It's just a sign that you might have more significant a stress injury. And now is a great time to reach out to competent, qualified help. And we do have the ability to guide you through All Clear Foundation, NERPS, the U tool itself, to clinicians who really get it. The third case is that we find many responders and healthcare workers have been reaching out for that licensed professional help. But unfortunately, we're finding with the surge in demand for services, clinicians are getting backlogged, the ones who are really qualified, who understand the job and the traumas and the stressors that we face. This can be used as an interim tool to help improve the quality of life, increase your capacity for dealing with the stressors in your life, and to help move you along the path toward healing until you can get into that appointment.
And some of the stuff that we're going to talk about really it's the clinical stuff that we would utilize in a session. It's really advice that I think is incredibly applicable, data-driven. I think it's very usable too. So I think it's a little bit more than just a random class. I think it gives people, if they have to wait in that interim, some really solid skill sets that really come from an educated clinician base.
Fantastic. So this series is designed for you to use on your own to benefit you and to be available to you 24/7.